Do we have any history? Do we know where the patient's coming from?
We're really invested in the trauma center, really embedded.
Say how far away they were.
About 20 minutes.
It's always been a goal of mine, so when you finally achieve it.
People that work here don't just see this as a job, they see it as
doing what God had called us to do.
Once the decision was made to become a trauma center, it took about a year or 18 months of preparation. And the great thing was that we were able to start from scratch and assemble really the best team of physicians and associates to take care of the most severely injured patients.
Get a chest x-ray.
Certainly when a patient's life is hanging in balance, you have to have people that can work effectively as a team, communicate effectively, respect each other, really have each other's interests and with the patient's interest at the heart of everything.
They may start in the emergency room, go to the floor, go to the operating room, then go to the intensive care unit, and then back to the floor, all in the course of a 4 or 5 day stay. And it's really important that we have a seamless integration and great communication between all parts of the center to help that work properly.
Mediastinum looks okay, no pneumothorax.
It was just a matter of kind of putting processes in place and guidelines and tweaking a few things here and there, but the skills were already here.
It is nice to show up to a facility where we know the people. We come here more than we go to any other hospital, and so when we're here and see crews and staff that we know, it's great to be able to transfer that patient care to them.
Gotcha, Kristen. Thanks.
When someone is going through a critical change, a life change because of the medical situation, it causes them to question, where is God in the midst of this? Why is God allowing this to happen?
These are individuals who are highly qualified, highly trained, but again, use the holistic approach and really understanding that you're dealing with patients and real people, not just a body in the bed.
Little things that are hard to pick out, but just when you put them all together, you kind of get a sense that things happen a little differently here.
It was the pinnacle of everything that we had been working for the last 3 to 5 years. But when we received a plaque that demonstrated that we were a Verfied trauma center, I snuggled with it. You just want to celebrate and shout from the rooftops that, hey, we're a trauma center now.
The goal is to become the trauma center that everybody looks to and says that if I'm severely injured, I want to be taken to St. Vincent.